So the goals of this presentation and the purpose of this in terms of the goals of the Arthritis Foundation and the panelists as clinicians and educators are to provide a forum that will inform both the scientific community, the patient community, and the research community to educate about the implications of PRP and BMAC, our bone marrow derived cells, and the future of orthobiologics or biological methods for reducing the morbidity of osteoarthritis and other diseases, to open the door and to inspire the opportunity to participate and to understand and engage with those who are working in the field and to contribute, and then to facilitate collaboration. The next slide. There are a number of points where there are tremendous questions. What are these autologous therapies that we can derive from blood or from bone marrow, and how are they different from other biologics? What is the evidence that they have clinical value in the knee? When and how should they be used? How do we convert the current promise that exists around the evidence and the practical means of harvesting and processing these cells into real evidence that clinicians and patients can use and to count on? And in that effort, there will be a need for prospective trials, collaborative registries, potentially biorepositories, and if so, how should those be designed? How should those be considered, and who should be engaged in contributing to those, and how should they be supported? There are also ethical as well as regulatory considerations about how these types of therapies can be conceived and communicated and offered to patient populations, first in a research environment and then in a clinical therapy environment. And so these are important for both patients and for clinicians to understand. And then from the perspective of the Arthritis Foundation, which is providing this forum, what else can the Arthritis Foundation do to serve patients and the clinician and the research community to advance the needs of patients with arthritis?